Alright Rogers, let's not keep the audience waiting. Go ahead and do a quick inspection of this child from head to toe. Tell me what you find.
Well, I can see some, pedal edema, and, there's a bit of, wasting.
A bit of wasting. How generous of you. I'm sure the child appreciates the understatement. Go on, anything else?
Oh, yes, there's also some hair changes, and, maybe a bit of stomatitis, I think. Angular stomatitis.
Maybe a bit. You're really on a roll with the maybes today. Anything else, or are we done with your guesswork?
No, that's, all I can see for now.
Oh, what a relief. Only wasting, edema, hair changes, and stomatitis. No dermatosis or apathy to complete the picture. Well, I suppose we're being modest today.
Right, sorry, I forgot to mention dermatosis and apathy.
Of course, how could you forget? Anyway, let's move on, shall we? What's the diagnosis for this poor child?
Kwashiorkor, I think. Or maybe marasmic kwashiorkor.
Oh, you think? Well, I hope you start thinking a little harder because you're right this time. Severe malnutrition it is. Lucky guess.
Yeah, lucky, I guess.
Alright, lucky man. Now, what treatment would you offer? And try not to guess this time.
I'd start with, maybe penicillin and folic acid.
Wow, folic acid and penicillin. Well, I hope this child likes surprises, because you've left out quite a few important things.
I'd also give some vitamin A and, F75 milk.
Bravo, you're crawling towards the answer. Don't forget the gentamicin, dextrose, and maybe keeping the child warm so they don't turn into an ice sculpture while you figure out the rest.
Right, yes, I'll add those too.
Fantastic. Now, let's see if you know your numbers. How much protein and calories are in F75?
Protein, I think it's like 1 gram per 100 milliliters. And the calories, 50 per 100 milliliters.
Ah, so close yet so far. Not even the F75 would forgive you for that. It's 0.9 grams of protein per 100 milliliters and 75 calories per 100 milliliters. Better start memorizing.
I see. I'll remember that.
You better. Now, what's one important investigation you'd run to affect treatment outcome?
Maybe a chest X-ray.
Maybe. Why not throw in an MRI while you're at it? But yes, chest X-ray is one, or you could also check for HIV. Don't keep all your eggs in one diagnostic basket.
Right. HIV test as well.
Yes, glad to see the light bulb finally flickered. Now, moving on to another patient, describe any striking features you see.
Severe wasting.
Oh, we're back with the maybe severe again. Yes, severe wasting, definitely. What are your differential diagnoses?
Marasmus, child neglect, and maybe tuberculosis.
Oh, Rogers, you're spoiling me with your maybes. Yes, those are decent guesses, although RVD and malignancy wouldn't hurt to think about either.
Got it.
Good. Now, this patient has had diarrhea for more than 14 days. What pathogens could be causing this lovely little gift?
Salmonella, Giardia lumblia, Cryptosporidium, and, maybe E. coli.
Maybe E. coli. Enteropathogenic E. coli, to be precise, but I'll let that slide. At least you didn't disappoint with the others. Throw in Isospora belli, and you're good.
Okay.
Oh, don't get too comfortable. The diarrhea is now watery and perianal excoriation has developed. What's the most likely cause?
Lactose intolerance.
Look at you, finally a straight answer. Well done. And what investigation would confirm it?
Reducing substances in stool.
Look at that. No guessing this time. Yes, reducing substances or clonized. How would you manage this?
I'd give lactose-free milk, like, soya milk.
Perfect. And maybe fermented milk or yogurt if you feel fancy. You're starting to grow on me, Rogers.
Thanks, Dr. Namoshi.
Don't get too comfortable. Now, what are the ingredients of RUTF?
Groundnut, sugar, skimmed milk, and, vegetable oil.
Oh, almost there. Don't forget the mineral vitamin mix. Well done, you've survived, for now. Alright Rogers, another challenge for you. Peter here is 1 year and 6 months old, and his mother reports diarrhea and poor appetite for the past 2 weeks. His anthropometry is looking quite concerning. Weight for age and weight for length both below 2 SD, length for age below 3 SD, and he's got 1+ edema. Now, can you give me 3 criteria for inpatient management of severe acute malnutrition SAM?
I think one would be if there's bilateral pitting edema.
Oh, finally, an answer that doesn't make me want to cry. Yes, that's one. Keep going.
Another one could be, weight for length being less than -3 standard deviations.
We're getting warmer, but no, weight for length less than 3 SD is not quite a standalone criterion for inpatient management. Try again.
Oh, right. Then, maybe if there are signs of severe wasting.
Good guess, but severe wasting alone doesn't guarantee inpatient care. Think more critically, Rogers. Maybe this child's diarrhea might offer a clue.
Oh, if there's ongoing medical complications like severe diarrhea.
Finally, yes, medical complications like severe diarrhea would definitely qualify them. You're almost there. What's one more?
How about poor appetite?
Look at you. Yes, poor appetite is another important criterion. Took you long enough, but we got there.
Okay.
Now, does Peter qualify to be admitted for SAM based on the criteria? And how does he qualify or not qualify?
Yes, he qualifies because he has 1+ edema, and he's had diarrhea for 2 weeks, which is a medical complication.
Exactly, 1+ edema and the ongoing diarrhea. Spot on. You might actually pass this time.
Thanks.
Alright, now the fun part. What fluid would you use to manage Peter's diarrhea, and what's the advantage of using that fluid?
I'd use, Risomal.
Risomal. Ah, yes, you finally picked the right fluid. And why are we using it?
Because it's specifically formulated for malnourished children and helps correct electrolyte imbalances.
I could cry with joy. You're actually correct. Yes, Risomal helps manage electrolyte imbalances better than standard ORS for these kids. Look at you go.
I'm getting the hang of it.
Don't get too cocky just yet. Now, mention any 3 acute complications that increase mortality in children with severe acute malnutrition, Sam.
Well, hypoglycemia, hypothermia, and maybe sepsis.
Oh, you've really come through this time. Hypoglycemia, hypothermia, and sepsis are absolutely right. Well done, Rogers. Maybe there's hope for you after all.
Thanks, Dr. Namoshi.